Hello, good evening, everyone. Welcome here. Welcome to this first event of a series of conversation that we intend to have here with all of you. Hopefully, we hope to see you every time we gather here to have a conversation. So why did we decide, to engage people and while having a conversation, Ray and I? We are both mothers, we were both caregivers. I should say I am more now becoming a consultant because my son is older than hers. He's turning 35 in May. So, and we've shared a lot about our lived experiences all the time we chat. And we were like, we'd like to know what else is going on in the world, what other people are living, and also engage them and share also, for those who are new into this, in this life journey. So that's the first reason why we decided to do it. But we'll give you, as we continue to talk more and more, or the reason why we think this conversation should happen within the community. So I will stop here, let Ray take over, and I'll come back.
And I am Ray Blaylark, and my son is 26 years old. He will be 27, gosh, in about 2 months. Which is phenomenal, but just shocking to me, just because watching your kids grow up is a beautiful thing. And yes, I am a warrior mom, but more importantly, I am a community mom. And because I run the Sickle Cell Foundation of Minnesota, some of you may know me from that work. Others of you may know me from conferences that we've been at together or other Sickle Smart sessions. But as Miss Biba said, we've done a lot of talking just as moms, and sometimes it's with laughter and sometimes it's with tears, right? But what really became important is that we are bigger than our sickle cell, that we are complex beings, right? We are an intersection of a lot of things, sickle cell disease being just one of them. And so often we talk at people, but we want to talk with people. And so we wanted to make sure that we created an environment and a forum where we could just talk about the things that matter most. It might be sickle cell related, it might not, because guess what? Even if we didn't have sickle cell, we still have other healthcare issues. We still have other things happening in our lives. Sickle cell disease just comes along and complicates those things a little bit. But nonetheless, we want people to see themselves as more than their sickle cell. We are holistic in our being, and so that's why we're here to create a safe space for everyone. We want to get to know you. We want you to get to know us. We hope that for as much as you can, you'll be on camera. I think that human interaction, obviously the pandemic happened and everybody took to virtual, but there's something special about being able to see people's faces and us seeing one another. This is a no judgment zone. So it doesn't matter what you look like. It doesn't matter if there's kids in the background. That's okay, because you know what? We are here as just normal, ordinary people. We have no expectations of anyone, but we are glad that you're here. And this is our first kickoff for what will likely be a monthly event. But we want you all to be able to share with us what that looks like, right? This isn't necessarily a support group. You all may already be involved in support groups, but it is just this open conversation about all things that matter to all people. And the people in the room, that's who we're talking to. We will be, I do want to let people know, we will upload the video to YouTube so that people who are looking for support and trying to figure out how they fit into the community and finding their place, that they are able to see kind of the camaraderie and the conversation that we have so they can feel more comfortable. We have, hundreds, thousands even of babies born a year with sickle cell disease. That means we have new mamas, new daddies, new aunties and uncles who are just trying to figure out where to start. So,
and new grandmas.
And new grandmas. That's exactly right. Yes. Yes.
Yeah. So, yeah. And then we have to to sit and look into our own lives and have this conversation, because as you know, sickle cell affects you in so many ways: your self-esteem, your integrity, and your health, can get compromised when you're even seeking care. You know, while you're in the process of seeking care, we go so many traumatic events. And also when you're living our normal life, you know, from school to jobs, if you are a sickle cell patient yourself, or a caregiver, or even a partner, or just a friend. So yes, so what we want to do now, we're gonna just talk to you and then allow you to introduce yourself if that's what you want to do. If you don't want to do it, it's fine. We can continue the conversation. So who wants to go first?
Duran?
I'll go. I guess I'll go first.
Oh, okay. Just come on
I'll
off,
go.
y'all. This is a conversation, like in the house when everybody talking over everybody. That's what we gonna do.
All right, I'll go. I am 26. I also have a sickle cell trait, but I'm also a rare disease patient as well. And so I am an advocate for rare disease as well too. So
Welcome.
And Duran, did you see, and tell us where you saw the promotion or the advertisement for tonight's session?
so I saw it on LinkedIn from Ray.
Yeah, LinkedIn, it works.
It works. Okay, good to know.
Okay, next person. Hi, Cheryl.
Hi, my name is Cheryl Cannon. I live in Albany, New York. I am a sickle cell parent advocate. I am also a member of the Westchester Sickle Cell Outreach, as well as a member of Sickle Cell Thalassemia Patients Network in Brooklyn. My son was born with sickle cell disease. He died around 5 years ago due to complications, you know, from sickle cell disease. He was in his own right, he was quite the sickle cell warrior. He was really involved, and he traveled to try to increase awareness of sickle cell disease. And I'm glad to be here. I saw the advertisement. I got an email from Gladys McGee, the Rochester Sickle Cell Advocates.
I know exactly who she is. She's an amazing woman.
Yes, she is. Yes, she is.
All right, who's next?
Thanks for being here. Okay, it's okay. So we can just carry on the conversation if nobody wants to talk for now.
Yeah.
But feel free to talk later. If you want to just say something, well, then introduce yourself and then go on. Right?
Terrence isn't shy. I know Terrence isn't shy.
Yes, I'm Terrence from Chicago.
Oh.
I met Ray during one conference. I'm 43 years old, living with sickle cell trait now. I was fortunate and blessed to have a stem cell transplant.
How long ago?
It's been 7 years ago now. But everything's going well, and I want to say that since being free of my complications, I'm able to, I want to say, maintain, do things that I couldn't do before. Be in the elements of the code, without having the pain crisis or anything, or going into pain. So everything's been going well so far.
Awesome. Congratulations on your successful transplant. Did you say you're 43?
43.
43, all right.
Yes, ma'am.
All right, 43 blessed years.
Yes, ma'am. Thank you.
Well, Renee, since you're off mute.
Renee Kirby, sickle cell advocate. I have SC hemoglobin genotype, and I'm a sickle cell, not only a warrior, but I'm also a mentor for other warriors in the community.
Awesome.
Awesome. Thank you.
Thanks for coming. All right. If anyone else would like to say anything at any time, and by the way, this is an open forum. It was designed to be just that. So if you're on mute, if you're not on mute, either way is perfectly fine. We are literally having conversations. And thank you, Etta. I saw your message. And it is important to us that we create this space so that we can talk about whatever comes up. Sheila.
Yes.
Go right ahead.
Hi, Miss Biba.
Hi. Hi, Miss Sheila. How are you doing?
Oh, I'm getting better.
Okay, I'm glad to hear that. But usually we call her Mama Merch.
Yes, that's
Mama
my
Merch.
other name.
I love it. That's
Mama
my new
Merch.
name.
Yeah, I'm a sickle cell trait and a caregiver.
Yes.
So what can I say? Like Miss Biba say, Miss Biba, what's the word you use nowadays? Someone to give advice. I don't even remember.
Yes, a consultant. Because
Yes,
yes,
I'm a consultant.
in your warrior's life. Yeah.
Oh yes.
Your son is an adult.
Oh yes. So definitely, I'm a caregiver, consultant. Put it all together.
Yeah.
Yeah. My son has sickle cell. He was born with SS.
Okay. And how old is your son?
Oh, how old is he? He's 48.
Okay. Okay. Thank you for sharing that. Wow.
And she's joining us from Toronto, Canada.
Okay, you're in Canada.
Yeah.
Oh yeah.
Where it's still cold, like Minnesota.
Yeah.
Well, Minnesota, we all have bipolar weather up here.
Oh, it's nice and warm out here. It's 28 degrees.
Today,
Oh yeah.
today, who knows what it'll be tomorrow?
Oh, tomorrow is not so bad. Probably about 24.
Yes.
Still
yes.
good.
Yeah.
Well, thank you so much. I'm so glad that you joined us. All right, I see that we had a couple more people join. We're just doing introductions. Biba and I have introduced ourselves, but you are open to introduce yourself if you'd like to.
Hello, all. I'm Ebony. I am an ambassador of the Sickle Cell Foundation of Minnesota, mentoring under Ray, open to learn, and just support the community and make sure that communities gets what it needs to thrive.
Thank you for coming, Ebony. I appreciate that.
Thank you. Yeah, thanks for coming.
Anyone else?
I can go. I learned about this from Ms. Biba. I started following her on Facebook.
Yeah.
And I have family members who have sickle cell disease and sickle cell trait. And I'm currently a PhD student, and my thesis is on the sexual experiences of people living with sickle cell disease.
Wow.
Wow.
Wow. Oh, girl,
Yes.
I'm just going
Let me ask you a question. Why did you decide to specifically work on that topic?
I started out just doing sexual health in general among Black people. And then I saw that a taboo, and then just like with my friends and stuff, I just thought about, well, there's this added layer of being within a taboo community and having this health condition. And so where do they have the space to talk about their sexual experiences?
I agree.
Wow. It's so funny you said that, because I just said to someone earlier today who was talking about the impact of sickle cell disease, on the child and the family. I said, what we have to remember is that it actually impacts the entire community, because your choices of mate, how you do your family planning, whom you choose to be with, is impacted, whether you're talking about it or you're not. It's impactful. So I'm so curious about your work, but thank you for sharing that. That's fantastic.
I'm sure we're going to have an opportunity to hear, more from your work, and feel free to reach out to us if you're looking for people to talk to who have gone through some experiences, because I'm sure you're going to talk about the complication that the men have, when it comes to sickle cell priapisms, and all those situations that they have to go through, and we have to talk about it. And I'm so pleased when I see young Black people choosing specifically to work on any sickle cell related topic. It means it's good for us, right? It's good for our community. So thanks for doing that, Brittany. And thanks for being here.
You're welcome. Thank you.
Yeah. Well, before we go, I would like to get back, just, Ray, I would like to talk back, I would like to talk to Cheryl about what she shared about losing her
Yes.
son.
Yes.
I am so sorry. I'm so sorry for your loss, dear.
Thank you.
And this also is a conversation that we must have in this community. Recently in Canada, we lost a young warrior who was just turning 24. And I even talked to her mom, to his mom a couple of days ago again, just to check on her to see how she's doing. And we know how sickle cell is, and we know how sickle cell impact. And then, we have to be aware, but I feel like nothing has been done. Nothing is being done for parents. Like Terry, I'm glad to see you still being involved in the community, but usually from my experience, what I've seen, when the warrior is gone, the parent is just left, forgotten, and then they just stop being involved. So I want you to know that your family and your experience and your presence here is important to us, and your experience is valuable. And we continue to honor his memory by you being here.
Thank you very much.
Yeah, thank you.
And I think that what's wonderful about all of you is that when Biba and I began envisioning this, we wanted it to be a cross-section of all communities. We wanted it to be male and female. We wanted it to be people who were new to this being caregivers or new to their experiences with sickle cell. Some people were diagnosed late in life, right? But we also wanted it to be warriors who had, warrior moms and caregivers who had lost their children, so that they knew that they were still part of the community. So in so many ways, you all are the fulfillment of so many of the very things that we talked about. And yes, once sickle cell has touched your life, you are part of this community. And I'm going to include sickle cell trait. I always include sickle cell trait. I think that's another piece that we have to do a much better job of. For myself, I learned that I had sickle cell trait in 11th grade. It wasn't explained to me what that meant. And in 11th grade, I didn't know and I didn't care, right? Yeah. It was 7 years later that word came back up, but this time it came up during a visit with the doctor for my newborn 2-week-old son. And 7 years of me not knowing and putting 2 and 2 together reminds me every day, the work that I do, that we still have work to be done, that we have to be able to have conversations, there's nothing to be ashamed of. We are who we were created to be. And that comes with lots of things. Some things are good and some things doesn't feel too good, but we all have this strength within us to carry on and to be a strength to one another. We're not designed to do it alone. We're not.
And we're not, exactly. And I must add that we should really have the honest conversation on this platform. The reason being that if we start talking about sickle cell trait, there are 2 important factors that we have to consider. First, when healthcare providers tell us that you're not sick, it's not a disease, it's nothing, so don't worry about it. Go on and live your life. Well, both Ray and I'm sure you two still have experienced so many things with our health that they couldn't explain. And I'm sure if there was more research done on sickle cell trait, they will find out that maybe it's related, right? So that's one. Sorry, I have to do this.
Yes,
and another thing is that it's our responsibility to educate ourselves and educate all people who are sickle cell carriers, so that we can maybe begin to talk about reproductive health and considering making the right decision when you know that you have sickle cell trait. That's a very difficult part in this community sometimes, but we were going to have that conversation here, just so you know, because I'm passionate about it. Both Ray and I didn't know that, we're going to have kids with sickle cell. It happened. I was a young mom just like you. And I can tell you how it has impacted our lives.
Yes.
So many broken dreams.
Yes. Yeah, I when I worked in the clinical setting, you know, one of the things that I worked on in the peds, and one of the things that I would tell families when, you know, they receive that diagnosis is it's okay to mourn what you thought life was going to be. You don't have to hold that in. That's a very real part of learning to accept your disease or your child's disease. Why was that so important to me? Because I always felt like I needed to kind of ignore this disappointment. I felt like maybe I'm being selfish. Maybe I'm thinking it was just about me. Maybe, you know, I didn't want to allow myself to feel like I'm thinking negative, right? But I also deprived myself of a very natural emotion, sadness, disappointment.
I know. But guess what? I've never felt any type of shame or guilt. Never myself, but a lot of sadness. Yes, I did.
Yes.
For the pain that my child was going through. Every time he was in pain in his body, it was hurting my heart and my soul. So I know how it is, because you look at, and there's nothing you can do, you know, to help that person. So, but I don't know, like guilt, when people talk about it, I'm like, I didn't even have, like, you know, when you are fighting to survive or keep somebody alive just to do your best with limited resources, I don't even think I had the luxury to sit and think. I just had to fight. Yeah, I just had to fight the disease, fight every day. So that's why I take it. This warrior mom title, yes, it is.
It's funny you say that, because when I first started my advocacy journey, my son was probably about 6 or 7. And, you know, some of you are, I'm 50 now, so that was a little while ago, 20 years ago, but there was no internet. I would print these little papers and then fold them 4 times so they became a little pamphlet, and said, do you know your trait status, right? I would walk around in areas of people that looked like me, because I was so disappointed that no one had talked to me about something that was so prevalent in my own community. And I didn't know what to do with that. And I didn't want anyone to feel the ways that I was feeling. To Biba's point, I never felt ashamed of it. And I never felt my son should be ashamed of it. And in fact, I felt like, okay, this was given to me because there must be something inside of me that says I can do it. And some days I got to search for it. Some days I got to dig deep for it. But shame was never part of that. But yet I also recognize that we have people in our community who do feel some kind of way, who do feel guilt, who do feel shame, who do feel stigma. And it might not be of their own making. Maybe the people around them are contributing to those feelings. And so if that's you, we're here to embrace you and tell you that you are okay just the way you are. You didn't do anything wrong.
Yeah.
Not a thing.
Not anything. No.
Not a thing.
No. And
we all do the best that we can with what we have.
Yes. So the journey starts with you acknowledging what you have, you know, and you have sickle cell. Sickle cell does not have you, you know. So we have to take it that way. I remember, as you said, you know, I'm going back to the beginning when my son was born in sub-Saharan Africa. There was no internet. There was no patient group. There was no library where I can go and get any type of information. It was just me and the physicians, one pediatrician for the entire city who was treating kids. So not even a hematologist, you know, he was doing his best, but he did a good job because he kept him alive. And I remember that I had friends who were in med school. I had to go to them and take their notes to read, just to learn what sickle cell was and how it could impact his life. So that, from that time to now where we're standing, you know, now that he's 35, I always know that that's what saved his life. That's exactly why he's still alive today, is because I educated myself. I went to people who had the information, got those medical champions to educate me so that I can do the best thing that I can. So also this conversation is about making you become the best self-advocate for yourself. And if somebody in your life is there also for them to learn.
And I'm curious, I want to hear from you all, because Biba and I, we talk all the time.
Oh, yes.
We could talk forever, y'all. Listen, I mean, forever. But I want to hear, do you all remember first learning that you had sickle cell disease? Or tell us about that, or tell us about when you learned that your child, was diagnosed, or a family member had it. Tell us your experiences and what kind of messages you've received from the community about your sickle cell, good and bad.
I want to say that when I was born with sickle cell, I was born with sickle cell SS, and during my childhood years, my community was receptive of me having sickle cell. My friends, they was, I want to say watchful, having my back and everything, but when I was going through my episodes and everything, because when I was 7, I experienced a stroke. So keeping up with school was kind of difficult at the time, but I was able to be homeschooled, and even had the opportunity to go to PT, OT, and everything, just to get back on track, of regaining my strength and everything. But once I was able to do that, everything was I want to say I paced myself, did things that I could do on my time. Wasn't rushing anything. I know that I had to be mindful of the things I do. If I want to overexert myself. I want to say, being born in Chicago, I know at the time when I was a child, when my doctors relocated to UI Health, was UI Health now, but UIC. My mom, she upshipped with them, and if I could continue to care under my doctors at the time. But other than having like pain crisis, the acute chest syndrome, and I want to say I had the left hip replacement too. So going through those trials and tribulations, it was a thing to go through. I know it took time away from me going to school and everything, but I know that I have a huge faith in God, and I know that uplifting prayers and everything will help keep my mind at ease, and knowing that I wouldn't have to go through too much, but I know that the things I go through, they have me become stronger.
You're saying something that I think is really important, because one of the things I don't hear about is our community, and particularly the Black community, is greatly rooted in their faith, whatever that faith might be. We don't talk about that piece enough. It is not about what your faith is, whose faith is this or who. It's about the fact that you have a faith. It's about the fact that you have something to believe in higher than you, and that that they are with you and that they keep you, because there are those days that all you have is that little silent prayer, and yes. So I appreciate you saying that. Particularly, I love the fact that we have men on here. I could just do a dance right now, because creating space for our warriors. There are, just being the mom of a male, I have learned that males need a particular type of space to really truly feel comfortable in, to really truly feel safe. Would that be correct? I got 2 males on here. Y'all gonna back me up?
Yes, that's what we try to do in Chicago.
That's correct. That's correct.
I think you have 4.
Absolutely. Absolutely.
Absolutely. I see that Chris is on. Chris, can we hear you? Can you talk?
We navigate quite a bit differently than
I'm
than
on
you
this.
guys navigate. Can you hear me or am I too low?
You're pretty low.
Okay, hold on. Let me see.
I'm on Zoom anyways.
All right. Can you
Yeah,
hear me
say
now?
more.
All right. Well, we tend to navigate a lot different than ladies. And we actually have other things we like to talk about, or we talk about. Not that we don't appreciate the information and you guys carrying the banner for a while. We do, but there's things that that we get into that have to do with men and men's virility and the thought process behind you being a man and you wanting to be the provider and you can't be the provider.
That part.
How
Yeah.
to mentally deal with the fact that, hey, you can only do what you can do, and the person that with you has to understand that there is a breaking point. That someday you're not gonna be able to get up and run the way you want to run. It's just gonna happen. There's no way around it. There's no ifs, ands, or buts about it. It's gonna happen. So I think we navigate a bit different, but at the same time, the information is good no matter who it comes from.
Yeah, and you're so right. My son taught me that, and it took into his adult years before I understood the gravity of that, particularly around the masculinity piece. Coming into age, it's and feeling like you could be a protector, you could be a provider, right? Those are very, very real things in a society, in a world society, a global society that does not build Black men up. And I can say Black people, absolutely, but we see a particular type of oppression against Black men, just like we see particular types of oppression against Black women. So I love that you all felt safe enough to be able to say that. Chris, I also saw that you put in there about school and about the fact that teachers were sympathetic towards kids with cancer, but not kids with sickle cell. That's so true. I would even say hospitals. I would say clinics. I would say doctors.
I've had doctors tell me that. Some of them say, I don't have the same resources to treat sickle cell.
Yes.
That I am given to treat kids with cancer. So
but empathy is free. Empathy don't cost you a thing.
Thank you. Well, that's it. You've summarized it. Thanks for saying it. But I don't know if you anyone here is familiar with the SHAPE survey that we did recently. About I think 17 countries participated. It was done by GBT, that is now Pfizer, and for the first time, healthcare professionals, caregivers, and people living with sickle cell were interviewed. And one of the things that came up is that they were just saying, they were being honest by saying that they were not equipped actually to even care for people with sickle cell. It's not even about not having, because yes, empathy is free, but if you are not well trained, if you don't have the information that you need, if you don't know how to treat a patient, of course your relationship is going to be different than when you are really comfortable. You have seen it in med school, you've had experience working with people with the condition. So I think that also is one of the reasons why we're having this issue. So as we're talking about men being here, I see Mr. Gallagher. Is that how we pronounce your name? Okay. Can you talk to us? Tell us, introduce yourself. Tell us why you're here.
No,
Hi.
Sean.
Hey, Ray, how you doing?
Hi, Sean.
Hey, yeah, I'm happy to be here. My name's Sean Geller. I'm the regional director with Emmaus Life Sciences, and we have Endari, which is an oral therapy for sickle cell disease. So wanted to be here. It's all about support. And, my side of this, I started with the company in June of 2020. When I came here, I had really no knowledge and understanding of sickle cell disease when I came here, but in the 2.5 years that I've been here, I've learned quite a bit about it. Talking a lot, honestly, with folks like Ray, and coming on to these kind of meetings and hearing from all the patients. It's amazing how knowledgeable the patients are about things, because you're right. There's a lot of doctors who don't know a whole lot out there. That's our biggest challenge, is trying to educate the medical community more about treatment options. I was just at I had a dinner program in Chicago that Ray's friend Talana came to, but there was a pharmacist there, and she has sickle cell, but she has SC. And because she has SC, her doctor had told her, well, you have SC, there's nothing we can do for you. Because they look at SC as not being the same as SS or some of the other genotypes, right? But even though SC patients may not experience the same frequency of crisis, for example, that others do, they still get them, and there's still damage being done to the body, still need to take care of themselves. So what she was really impressed was, one of our case studies that we presented at the program was that there was an SC patient presented, because you can use Indari for all genotypes. And for her, she goes, if I wasn't a pharmacist and had the ability to look up information to know where to go, I would have been, lost, and would have just thought that there was no other options for me. And unfortunately, there are providers who don't give patients all the options, and that's a battle that we face all the time. We're trying to convince them that we need to share with patients what are the options that are out there. Right. So we come here to be able to provide that information directly to patients, loved ones, caregivers, parents, etc., so that they can take it and go back and have a different type of conversation with their providers about it. I've met some really great providers who do a great job taking care of sickle cell patients. They do their best, but like with anything else, there's also folks who don't, and there's a lot of things to overcome with that. There's a lot of perceptions in the medical community sometimes with sickle cell patients. But you have to, there's a lot of understanding that has to take place where they'll complain, well, they're not compliant even with appointments. Well, they're not compliant with appointments sometimes because unfortunately the patients don't have means of getting to the appointments.
There's so many reasons. So many
facets. Yeah. It's not
and
just
one of the things you said, I just want to circle back real quick, because the literature only knows those who were included in a study. So when we talk about SC, SS, S beta thalassemia, SD, SE, SO, there is no cookie cutter for any of them. I've seen SC patients who have more crises than an SS patient I know. I've seen an SD person lose their life because of the complications and the physicians didn't understand that there are still those complications. Just having that sickle hemoglobin in your body, which is another reason why we really must do more research on sickle cell trait. We must, if we know that 2 copies of the gene, wreak havoc on a person with SS, and we know that it wreaks havoc on a person with SC or any other variation combined with it, then we should be more than curious about what it means to carry it in our bodies at all. I'm one of probably a half a dozen people that I know who are warrior moms who struggle with anemia. I have to get iron infusions. My hemoglobin is lower than my son's, who has sickle cell disease, right? That's very concerning to me, because when I talk to my doctors about it, they're very dismissive. They're like, oh, it's just anemia. It's just, don't worry. And we have to get to the place where our voice is heard, and it's heard on a level that they will do more studies, that they will do more research and investigation. I love the fact that we have someone who for their PhD is studying sexuality in the sickle cell population. I got, matter of fact, make sure, is she still on here?
Yeah, she's here.
She might have had to drop off, but, oh, there she is, Brittany. I got to connect you with my friend Tiana, who has SC Red, in case you don't know her. She is the Sickle Cell Reproductive Education Directive, CBO, in the sickle cell community. She's doing amazing things with reproductive rights, right? And reproductive health, reproductive justice. And so I would imagine there's some intersection there, but this is why conversation is important. This is why we have to make sure that people understand that there's a safe space for everyone. For everyone.
Yes, for everyone. And the most important thing for anybody living with sickle cell disease, because there are those limitations that all healthcare providers have, it's very important that you educate yourself. You have the information, and then you sit and have a conversation with them about your care. This is your care. This is your life. So you should be part of the conversation, not be told what to do, because you know how your body is, you know your body. And in some situations, you are even the expert. The physician is not an expert, right? They know about so many diseases, but you've been living with the disease for so long that you can easily say it, know what's going on in your body and explain it more than anybody. So it's important. And also knowing the options that are available out there. It's up to you to get the information and talk to them about your care, to say, how can this be added to my treatment regimen, because I've heard about it. I've heard some good things about it. I want to try it.
You're right. And one of the things that I used to say, so when I was hired onto the clinic, and I was hired as a program manager and patient family health advocate, there were a couple of things that I demanded that they reconsider. I demanded that they reconsider giving new, and again, I was in the peds, right? So I was with people from the time they found out their child had sickle cell up until age 21. And I said, if I take this job, I need you to do a couple of things. Number one, I need you to understand that knowledge is power, and the absence of knowledge is oppression. Because if you have knowledge and you're not passing that along, then you are part of the problem. I need you to make sure that whether you think a family is ready for curative therapy options, whether you think they're ready for a particular medication, that you at least tell them about it, that you at least have a conversation, because it's part of them growing knowledge. And the other piece that I said is, I need you to stop always talking about this age of expectancy, because it doesn't take into consideration the fact that there's medical science that's happening. What you tell me now when my child is born will be something totally different when my child's 15. That's 15 years later. Now, don't get me wrong, medical science moves pretty slow in the Black community, but it does move.
Yeah.
And so we have to make sure that we are creating an environment of hope. That doesn't mean that you're not being realistic, but there's always something to hold on to. There's a lot of work being done in the back room. I call it there's people in the back room and the boardroom, just like there's people in the emergency room. We got to make sure that what's happening in boardrooms trickles down to the people who are in the emergency rooms.
Mm-hmm.
We have to, because that's what maintains hope.
Yeah, but I would say even more than that. We have to be in that boardroom, sitting there, being part of the conversation, so that we can bring the change that is needed.
Yes, that's how I got to that point, from sitting in those rooms. And I'm like, the community has no idea you're working on this.
Yes.
They need to know that, because they're losing hope.
Yeah, absolutely. But we are pushing, we are in every discussion, because like this afternoon, I had a meeting. I did a presentation about inclusion and equity for teachers. And the reason why they invited me is because they wanted to see how they can work with our organization. And I was telling them, you have the kids in the classrooms, you have them from elementary school to high school, and you need to know what sickle cell is, how it impacts their lives, so that you can give them the accommodation that they need to have a better chance of success in school. So we had a long conversation, and I explained to them even the fact that a child needs to drink water, right? More water than another child, and they will take breaks all the time, or they can't go outside. Canada is so cold. When it's -30, it's a trigger for a sickle cell crisis when it's too hot. So and they were very surprised. They didn't know about all that. So they were very happy that we had a conversation. So that's one of the things that also, I always come from a place where, allyship is very important for us to build those relationships and work with anybody who can help us advocate and care for those living.
Yes. Parents, I see your hand.
Yeah.
I was just gonna say that I think that was 2 weeks ago we did the policy forum with
Yeah, yeah.
with
The
Sickle.
policy forum was great.
When our team from Illinois spoke with representatives from Illinois, I spoke about mental health for warriors. I know that different types of crisis and episodes could do something, man, could have effects on individuals with this sickle cell, not just the warriors, but also the families.
Absolutely.
I
Absolutely.
advocated for more treatments for mental health awareness for both the families, because there are things that people go through when their sons or daughters have to be in the hospital during a period of time. And I know I recently graduated last year with my master's in mental health and wellness.
All right.
And,
All right. Wow. We got to make sure that the community knows that and understands how you're practicing and how you're going to use that. That is amazing. That is absolutely amazing. And you're right. In full disclosure, some of that my lack of going through the proper mourning, I didn't understand was contributing to my early depression when I first got the diagnosis. I didn't understand that. I didn't understand. I never allowed myself to mourn what I thought it was going to be.
Yeah.
yes.
And even though I never felt shame, I was in this dark place of what do I do? How do I do it? Where do I go from here? How do I protect him? How do I keep him alive? All of these questions that felt overwhelming.
Yes.
So you're right.
And then also the fact that you yourself, you are only human, right? So I was thinking about, I don't think any healthcare providers I've met, along all these years while seeking care for my son has ever stopped to say, how are you doing?
That's right.
Do you need any help? No one, even in the family, even around me, people just are here to help, but they will say, how can I help you care for this child? But they don't think
one doctor. He's now our medical director.
Then that's the reason why he's there.
And that's the reason.
That's the reason. So I've thought about it so many times, and I think for a long time I've been working with a depression or all type of sort of mental health issues. But first, also, as I said in the beginning, I was born and raised in Africa, and we do not recognize mental health. An African person will tell you, that means it doesn't mean I'm crazy if I just acknowledge that I have any mental health pressure. So for me, I didn't know how to put a name on the feelings that I was going through. And when I was sad, I would think, well, it's normal, right? I have a child who is sick. When I was tired, exhausted, and with no energy, I would say, well, it's normal. You're going to school, you have a child. So, but I never thought that, I could take care of myself. But I lived in the US for 5 years, 1999 to 2004. And that was the first time that a physician told me that I think you're depressed.
Yes.
And yet I was like,
I did not, I didn't understand self-care. I still struggle to understand self-care. All these posts that be like, self-care is like, I did not see examples of that. What I saw is this grind from my people that never stopped, that was always giving, giving, giving. Now, I'm a preacher's kid, so, that was just part of what they did. I didn't know there was a whole nother world out there.
Okay, stop right there, Ray. I have to say something. Stop right there. You said it, so I'm going to bring the conversation because you mentioned religion earlier and I stayed quiet. One of the things that I struggled with at the beginning when I was younger and my son was diagnosed, my faith. Because when we were growing up, they will tell you that God protects the weak, God protects the child, God protects the poor against
the widows,
the widows and everything.
Yes.
So I sat there and I looked at that baby who was really, really in pain. And I went, well, so what's the lesson here? What has
Let's
he done?
talk about it. I love it.
What
Yes.
has he done to deserve this?
Yes.
You know,
Yes.
he came into this
Helpless.
world to a mom who wasn't ready to be a mother, and then now you put this. So you tell me that God is love, God is good, and you want me to sit and pray that, you know, the same God that has done this to save and help this child.
Absolutely.
Talk with that for years, for years. I think, I don't know how I got through it. You know, I was just struggling, and, you know, the community does not allow you to think otherwise. You can't have a discussion. It was really difficult. But at some point, as my son was going through crisis after crisis, surviving surgery at one, and then I remember I was 19 when they told me that in Africa, it's not the same system as here in North America. We don't have the blood all the time. You're gonna have to go and find people to donate blood, and then in exchange, we're gonna keep blood for your child. So I was doing all that to get people to come and donate blood. And at some point I stopped and I said, but this baby is still here. And the physician told me that if he makes it to 5, it will be good. And if he's able to make it to 15, that it's a miracle. But he was still alive. So I'm like, there must be something stronger than my only will as a mom to keep him here, and what the physicians were doing, you know, to keep him alive. So that's when maybe I was able to restore and kind of, you know, faith. But when I really understood the message was also when I realized that he was okay, he was happy, he was here, and I said, okay, then maybe there is a reason why this child has chosen me to be his mother.
You know, that is such a good point. Yeah, because that goes back to what I said about there must be something in me, but that says I can do it, something inside of me. But you know what else I said? I still accepted the fact that I'm on borrowed time.
Yes. Okay.
Come on now. Like, okay, because I as much as my faith grounds me, it also reminds me that he's in control, and when that time is done, it's done, and how I need to embrace that. Like, we don't talk about preparing our hearts and minds, you know, but the reality is, and I tell my son all the time, I could go before you. None of us know the day nor the hour. None of us.
I agree.
And so how we live our lives and the quality of life you have from day to day is so important.
So the mother and the advocate, the health advocate in me, also knows that, yes, it's true, we have our faith, but we have to be very careful how we let our faith interfere with our right to have access to care.
I agree.
Because I do not agree with the fact that they tell us to put everything in prayer.
No.
And research is not being done for sickle cell.
No.
Exactly.
Action.
Exactly. So when people are stuck, I tell them, let's advocate the right way. We are humans too. We deserve the best care. We deserve to have access to treatment options, right?
That's right.
Let it not only be about letting us, because this is an open forum. We talk about everything,
yes,
right?
It is. And we are here to be transparent with you all.
When the colonizer went to Africa, they find us with our lands, our gods, and everything.
That's right.
And after some generation, they left us with the Bible in our hands, and they took away everything we have.
You're really talking about it today.
So you do not tell me that I have to sit and pray for treatment option for my son who is struggling, you know, with his treatment currently. I want research to be done for sickle cell.
Yeah.
I want more treatment option for people. I want them to be treated, you know, with respect and, you know, and dignity.
Yes.
So
and I love that you are saying that, because this idea that just because we are grounded in our faith means we don't take action, means we don't have a righteous anger, we don't have the frustrations. I don't think that's I think that was taught in order to keep us a little docile, right? What I believe is that he gives us the strength from within to use our voice, to use our minds, to use our connections. And we have an obligation to use those pieces to contribute to making things better. Every generation has their own torches to carry. Every generation is about dismantling the oppression little by little and calling it out. But we have a responsibility, and it's easy to just sit back and say, it is what it is. But that I can't imagine the challenges that would come in addition to the already challenges I have no control over if I just take my hands off of it and just say, well, whatever. So even though I accepted what my situation was, I also set out to say, I'm not settled at just this. I got to make some things better. Yes. What can I do to make some things better? No matter how long the borrowed time is, whether it's my borrowed time or his borrowed time.
Yeah. And let me tell you, I know you're already doing a lot. So one of the factors also, let's put the faith aside and I talk about another issue that we have in the community is the lack of unity. I've always looked at the sickle cell community. Do you know that? And we all know it, that democracy is about number. And we have the number. But how come we're not able to get things done for ourselves? Right? So you look at how many sickle cell organizations we have, how many advocates we have all over the world with so many skills and experiences. So let's say if we come together and we set the priorities for our community and we all work globally, wherever we are.
Globally.
All have, yes, globally. We all have the same message.
How did we get to our name? Because we were talking about how do we bring Africa and North America together?
Yes. Yeah.
Together. Because we cannot focus on what makes us different. We must focus on what makes us the same. We are brothers and sisters. We must link arms for a better tomorrow. Yes. That's what I love about this. That's what I love about us.
Because I'm sitting here, I'm like, how come Ndari is available in America and not available?
I was waiting until you said it. I knew it was going to
come out. I was thinking, how come Ndari is not in Africa this time? I come from Niger. In one city, we have 7,000 individuals living with sickle cell disease.
You don't need refrigeration. You don't need any of that. So
exactly. So how do we make it available, like wherever you are, regardless of your geographical location, that you have access to the same treatment option? That's how we change things for ourselves, not by just letting it be just available for a group of people. So that is about unity.
That's
advocating with a strong, unified voice and making those taking the decision listening to us. Yeah. That's the only way. I always give the example of environment, Greenpeace. Look at what they've done. Look at what they were able to do. They took the same message, and whoever you are, rich, poor, black, non-black, whatever you are, Jewish, Muslim, you know that you have to recycle.
Yes.
And how did I do that? It's because they had the same consistent message. They work together, all organizations globally, and share the same message.
And they all want to get to the same goal, though they each may approach it differently. They don't use that as a reason to grow apart.
Exactly. And that's what happens. Until that happens in our community, I don't see really impactful and effective change happen anytime soon. We have to get to that, right? And yes, I see a message about cough. Yes, he did. A couple of physicians who were in America, in North America, had tried to bring, like he brought hydroxyurea in Ghana. They're trying, but it's just starting. It's just starting now. So we have to continue. We have to continue to talk. We have to continue to have this conversation and then do the work. Really, there's so much work to be done.
Yeah,
because it doesn't make sense that we are losing our kids under the age of 50.
Yeah,
I look at my son. I am way stronger than him now, and I see every year, as years pass, I'm looking at him and I'm seeing like sometimes I can do things that he cannot do, and I'm like, and this is not okay.
Yeah,
this is not okay. So we need to do better for ourselves first, and we need to demand that we be treated better also, because people treat you the way you let them treat you. I believe in that.
Well, absolutely. And I'm going to say it a little bit different. You teach people how to treat you.
Thank you. There you go.
You know, and I know that's a strong statement, y'all. Now, what I don't mean is be unprofessional. Okay, don't misinterpret my words. I didn't say go cuss them folks out. Okay, but what I am saying is when we learn how to use our voice, when we learn how to link arms best, and when we learn how to recognize the divisiveness that's implanted within us, we will not allow those situations to tear us apart. And so, you know, yes, there's a lot of power at play within the healthcare system globally. Let's just be honest. There's a lot of power at play. There's a lot of money being made, right? But what I do believe is that when we are able to, we all agree that our health matters, right? We all agree that something has to change. We all agree that we need to make sure that options for sickle cell disease are global and not just in one area. We all agree with that, right?
Yeah.
Again, we all have to understand we may get to that goal differently, but we cannot let it cause us to become separated. We can work with my greatest desire in the sickle cell community. And I'm glad you put it out there, B, because we said we're going to talk about the stuff nobody wants to talk about.
Yeah.
We said that. But what we have to learn is that as long as we are dependent on the systems that were built, that were not built for us, that they will find new ways to keep us out of being in positions of influence and power. So why aren't we creating infrastructure amongst ourselves, pipelines amongst ourselves? What I love about my friend Biba is that even though she lives in North America, it's not America, but it's North of America, but North America, she still makes sure that she goes home. She still makes sure that her land of origin is never lost. I think we in America have something to learn. I think that if we're not careful, we will develop, you know how we talk about white privilege? We cannot talk about American privilege. We have to recognize our American privilege within that same model.
Powerful, yes.
We must. Because sharing our resources does not deplete us. It strengthens us.
Yes, it does.
I need for industry. I told industry, I was at a meeting, a large meeting a couple of weeks ago, and I told industry, America doesn't do well focusing on two different continents for Black people. It's oftentimes either one or the other. They put all their resources in one or the other.
Yeah.
And that has to change because it puts us against each other.
Yeah.
And we shouldn't have to be pitted against each other. And I don't want to compete with my brothers and sisters for the funding that we need, right? This is funding disparities.
Yeah, it is. But for them also, I've done the math for them, if they can listen to me sometimes, is that the number of patients that are on the African continent, if they make their product available right there, you know, it's going to even be better than just keeping it for this minority that is here because of the cost. So they have to work it out in a way that it's just available everywhere in the world, and then we all benefit for it at the same time. It's the best thing. But it's up to us as a community to do that work also again for that to happen. Because advocacy, it takes advocacy and it takes collaboration. It takes a lot of work to get there. But we're gonna start with you because you're here today to bring Ndari to Canada. Because I've started that conversation a long time ago with your somebody in your team, but I don't know what happened. But we can.
That's what I love about having an open forum, because this is not about decreasing who we are, no matter who's in the room. We can say the hard stuff. We can speak truth to power. And we recognize that there are champions on the inside of industry. There are champions on the inside of healthcare. There are champions on the inside of education. There are champions on the inside of reproductive health. And what we have to do is make sure that they understand we have your back. You continue to have ours while you're on the inside. There's still spaces we can't get into. There's still boardrooms that we are trying to get into that we can't, that you might be able to get into.
Yes.
And so when we speak these things, it is not to exclude you. It's to say, these are our heart's desires. These are what we expect. And we need you to use your voice on the inside. We need you to open the door to allow us in so we can use our voice. It's important. That's part of the hope that lies within. And so each of you on this call, I don't believe that you would be here if you didn't believe that there was still a fight in you. There's a fight in each one of you. When I say fight, when I say warrior, I don't mean I don't mean an overly aggressive, but what I do mean is a persistence.
Yes, resilient with persistence.
A resilient, a motivated and resilient persistence in the effectiveness of your voice.
Absolutely. So, Ray, 8:07.
Yeah.
We have to be respectful and mindful of people's time.
We do.
This is just the beginning of a
Yes.
long conversation that we're going to have.
Yes.
So I see, and being confident of that voice. Yes, you have to be confident of that voice. So I think we have to wrap up today,
Yes.
right here, so that we can come back again next month and continue this conversation.
What we hope is that we created a space that's different than other spaces, a space where we can talk about the hard stuff, where things that are not being talked about, this is one of those inside the house conversations. You know how all y'all know you was told what you could talk about in the house, and you better not leave the house and talk about that. You better not tell them folks what's going on inside. We're having an in the house conversation here.
Yeah, we are. And
somebody's got to have it.
Yeah. And
yes, my mom always would say, oh, that's not for company.
That's right. That's exactly. So we are in the house conversations. We gonna call some things out because we can grow the same way we expect the healthcare system to grow, the industry to grow, other institutions to grow. We too can grow. We too can find our voice. We too can be self-empowered more effectively.
Yep.
So y'all coming back next week? We sure hope so. I mean, next week. No, not next week.
No,
next month.
Next month, yes.
The second Thursday of every month. We hope that you'll come back. Bring a friend. Bring your mama, your daddy, your cousin. Bring that friend. Bring the people who need to have this safe space to talk about the things that matter.
Exactly. And let's do something. Each tell 6. And then each bring maybe 2 next time, and then we're going to continue to grow. And if there is any specific topic you would like for us to talk about, send us an email. We will address it here.
And I will put the email address.
Yes, please.
There you are. If you have any feedback, we want to hear from you. We want to talk about the things that matter to you, right? And I already said it, we can talk forever, but we want to make sure that we are a reflection of the community. All right. Sean, we gave you some things to go back with. We gave you some things to think about.
And I'm listening, and I'll let you know, we are making inroads in other countries. It's primarily over in the Middle East right now. Andari is available in the UAE, Bahrain, Qatar, Kuwait. We're waiting on approval from Saudi Arabia as well. It's I wish it was an easy process, but it is not. Each of these countries and their governments require different types of submission paperwork. I think we've gone back with the Saudis 5 or 6 times on information that they want it in a certain way. So I think if our CEO had his way, Indaria would be all over the world all at once. But unfortunately, that's not how the world works. But that's where we need everyone's help with that, because, and again, that goes back to what you guys were talking about earlier. Knowledge is everything. The more you educate yourself, don't rely on what you see on a website or what's on the news. Read for yourself, find out the information on your own. The more you know, it's trust but verify. Find, don't just read, don't listen to one news channel, listen to several news channels. You got to hear everything, and you come to your own determination. But do your research on things. I met a doctor out of Memphis who does volunteer work in Africa. He wants to bring Indaria over there. I put him in touch with Charlie. We're trying to figure out if there's a way we can do it.
Suggest you connect with people who are indigenous to that area. And they can help you to navigate those spaces. Biba is an excellent person.
Yeah, so I think we should put, maybe her in touch with, with Charlie about that.
Yes, please. Let's do
that. Because, we sometimes need a connection inside these governments that can eliminate a lot of the red tape and make the process, a lot easier and stuff.
Yeah, and even if they're not in government, they understand the people, they understand how to navigate those spaces. Biba, I don't want to speak for you, but what I would say is the same way you come to the Black community, you have to go to the communities in Africa. Yeah. And work straight with them. Yep.
And every country is different. And that's what, we got to understand what's, what are the needs and what are the differences in each country and what they're looking for. So yeah, we're trying to make it as much of a global product as we can. The number of sickle cell patients here in the United States is minuscule compared to what's out in the rest of the world.
That's right.
And so they need help over, and it's sad to hear. The doctor who does the volunteer work in Africa told me the exact same thing you mentioned earlier, which is that if a family had a child with sickle cell disease, they wouldn't send them to school. They would just kind of keep them around the house to help out, because they knew the lifespan for the child wasn't very long. And, because there wasn't much hope, because in some of the really rural areas, you're not getting to treatment, there is no ER to take your child to or something like that. So it's really tough. And you're right, you live here in America. You take a lot of things for granted. My wife's from Armenia, and I visited Armenia 3 times. And the first time I went was in 2009. And, when I went there, I saw that people still filled up their bathtubs with water at night. And when I asked why, is because there was no guarantee the water would be on at night, 24/7. So if you had to use the bathroom in the middle of the night, you had water in the bathtub to flush the toilet. You take that for granted here, because the water's always on, the electricity is always there, the gas is always there. And you go to other countries and you start realizing how lucky you are here, because there are kids. I have a friend who's done volunteer work over in Africa. He goes, kids there go to school, and the schools, it's dirt floors, but they're just so happy that they're in school. Yet we complain here, well, the desks, which, it's fair to complain about the desk condition or something like that. But there's kids over there going to school on dirt floors. So don't judge it by the resorts that you go to in some of these countries. You got to get out and you see how lucky you have it here, and it makes you appreciate what you have. But we have to be able to, how do we, carry some of that over to other countries and make things like Indaria available to them as well. So,
well, thank you for being that champion. Thank you for being that champion.
Trying. And let us know how we can help.
Putting yourself in these spaces so that you can learn more. And leaning in, we appreciate that. And that's what it takes as we build relationships to make things better and to improve quality of life. So thank you. Thank you.
Yeah.
Biba, I will leave it to you. Second Thursday of every month. Yes. We have the next few sessions that are already listed on the registration. So I'll put the registration link back in the text, in the chat. No, I'm getting tired, huh? in the chat.
In the chat.
I'll put it in the chat, and Biba, I'll leave it to you to close.
So thank you so much. I think it warms my heart when I see that we are able to sit as a community and have a conversation like this. And my hope is that we're gonna continue to be here every month and continue to grow and work together for the benefit of all. And we're gonna learn from each other. We've heard your stories. Today we've heard what you've shared with us, but come back again and share more. Let's keep talking. Let's keep working together. That's how we're going to create the unity that we need to work together. And Ray and I have started this just in North America, but we don't know where it's going to go, where it's going to take us to, all together. So, and that's how we change things for others. Just the fact that we're sitting here sharing our stories is helping somebody else who has, is still working behind us, learn, and then go through their own path. Right? So thanks for being here, and we'll see you in a month.